Hi, my name is Dr. Alex Robles. I'm a reproductive endocrinologist and a fertility specialist at Columbia University Fertility Center. This presentation is on the role of diet on fertility, and also we'll go over some evidence-based strategies for fat loss. According to the World Health Organization, infertility affects about 48 million couples globally, which is equivalent to about 15% of couples that are trying to conceive. Said another way, about 1 in 6 couples are going to have difficulty conceiving. Now, fertility may be influenced by several factors, such as nutrition, diet, environment, and exposures to certain substances. And it's difficult to study a lot of these variables. And in particular, nutrition is one of the least studied factors when it comes to fertility. When you look at the studies, they can be confusing, contradictory, and even inconsistent. So whenever you're dealing with these kinds of situations, you have to look at what does the totality of evidence show? What do the vast majority of studies on nutrition and fertility demonstrate could have a positive impact? In 2023, a study was published in the journal Nutrients looking at the most studied dietary patterns and the relationships to fertility in both patients who were trying to conceive naturally and also patients who were undergoing in vitro fertilization. What they did was included 11 different studies of 6 different dietary patterns, and the diets were grouped into different groups: the Mediterranean diet, diets that were considered to be healthy, and diets that were considered to be unhealthy. And this is just a quick graph that you can see of all the different kinds of foods that were included in each of the diets, including the Mediterranean diets, the healthy diets, and the unhealthy diets. The foods highlighted in green indicate that those diets in particular had high intake of those nutrients, and the ones that are highlighted in orange indicates that the diet had a low intake of those nutrients. And for all 6 dietary patterns, the authors saw that there were fairly consistent associations in the direction across primary pregnancy outcome. And the one diet that had the most consistent outcomes is the Mediterranean diet. So many people probably have heard of the Mediterranean diet. It advocates for a high consumption of fruits, vegetables, fatty fish, other healthy fats like nuts, seeds, and olive oil, and a decreased intake of things like meats, dairy, saturated fats, and other types of junk food. In total, 5 studies looked at the Mediterranean diet, and they saw that in 3 out of those 5, there was a positively significant improved outcome in patients undergoing in vitro fertilization. And this was noted as an increase in pregnancies and in live birth. One of those studies saw 40% greater odds for being pregnant in patients that had the highest adherence to the Mediterranean diet. A second study also saw 40% greater odds of live birth, again, in those patients that had the highest adherence to the diet. And then the third study saw a whopping 300% increase for the likelihood of a live birth, again, in the patients in the highest percentile of adherence to the diet. The 2 studies that didn't show a benefit in clinical pregnancy rates and live birth rates did show positive associations. One of them did see that those patients on the Mediterranean diet had an increased number of embryos generated after an in vitro fertilization cycle. And the second study saw higher clinical pregnancy rates, particularly in patients that were over 35 years of age. Now, they took a look at 7 other healthy diets, and of those diets that the authors deemed to be, quote, healthy, only 2 of them reported improvements in either clinical pregnancies or live birth rates. And these were the fertility diet and the pro-fertility diet. So for the fertility diet, it was created by Shavaro and colleagues at Harvard, and it followed over 17,000 women without a history of infertility. And they followed these women for 8 years as they were trying to conceive. And overall, what they saw is that increased adherence to the fertility diet was associated with a lower risk of ovulatory disorders. And the women that had the lowest adherence to this group had a 66% higher chance of having difficulty with ovulation compared to women that had the highest adherence. Now, when you put them side by side, looking at the Mediterranean diet and Shavaro's fertility diet, you can see a lot of similar findings. So the Mediterranean diet advocates for a higher consumption of monounsaturated fats, and same thing with Shavaro's fertility diet. They both advocate for a higher consumption of vegetables and a reduction in animal protein sources. Shavaro's diet advocates for an improvement of both the quantity and quality of the carbohydrates consumed. And by that, they primarily want you to consume lower glycemic carbohydrates. And the Mediterranean diet also advocates for increased intake of whole grains and legumes, which are also low glycemic. The only place where these 2 diets differ are in dairy consumption. The Mediterranean diet actually advocates for reduced dairy consumption, whereas Shavaro's fertility diet recommends consuming high-fat dairy, instead of low-fat dairy. Now, what about the third diet, the pro-fertility diet? This was a study of 357 women who underwent multiple cycles of IVF, published in 2019. And they did a questionnaire to see how many of these patients were following what they created was the pro-fertility diet. In this particular diet, they were distinguishing between patients that were consuming high pesticide fruits and vegetables and low pesticide fruits and vegetables, and also asking the patients how many servings of whole grains did they consume per day, how much seafood did they eat relative to their total meat intake, how many servings of dairy they consume per day. Interestingly, they were also asking patients how many servings of soy foods were they consuming per day. Soy has been very controversial in the literature in regards to whether it has pro-fertility benefits or if it has negative benefits, but in this particular case, it seems that it was associated with positive benefits. In addition, they were also asking patients what supplements they were taking, and the ones that were of interest were folic acid, vitamin B12, and vitamin D. So the woman that had the highest adherence to the pro-fertility diet compared to the lowest adherence group saw beneficial increases in three factors. There was a 47% increase in implantation of embryos, a 43% increase in clinical pregnancy rates, and a 53% chance of having a baby, defined as a live birth. So when we put all of this evidence together, here are our best recommendations for the different kinds of foods that you should consume in your diet to potentially help improve your fertility. So increasing your intake of whole grains. And common examples of this are oats, rice, quinoa, millet, farro. Trying to consume multiple servings of fresh vegetables. And you can try to consume as many vegetables as possible. One good recommendation is to eat the rainbow. Try to eat vegetables of varying different colors. The same thing goes for fruits, specifically ones that are antioxidant rich, such as berries. Berries are also one of the lower glycemic fruits that you can consume in your diet. When it comes to different types of fats that you can consume, monounsaturated fatty acids are better than saturated fatty acids and trans fatty acids. And the monounsaturated fatty acids includes things like fish, olive oil, avocado, nuts, and seeds. When it comes to protein, having a preference for plant protein and seafood tends to show greater outcomes than consuming more meat or other animal-based proteins. So this includes things like legumes, which are also low glycemic carbohydrates that are high in protein, increasing your intake of fatty fish, and again, possibly soy, as we saw in that pro-fertility diet, which includes things like tofu, tempeh, and edamame. As far as full-fat dairy, this is questionable, as some studies show that it could be beneficial, whereas Mediterranean diet usually indicates a lower intake of dairy. And of course, milk, yogurt, and cheese are the biggest sources of dairy. And then as far as supplements to consider, vitamin D, folate, and B12 are often what's recommended. When it comes to the vegetables, you can consider the low pesticides versions of fruits and vegetables when possible, trying to buy organic. Now let's quickly shift gears to some supplements that could be potentially beneficial for fertility. There have been several supplements that have been studied in the literature. The most common ones are coenzyme Q10, DHEA, inositol, and a couple of others, N-acetylcysteine and L-carnitine. So let's go over what the data shows. So coenzyme Q10 is an enzyme that's important in the energy production of cells, and it also plays a key role as an antioxidant. So this is another systematic review and meta-analysis of 5 different studies that included over 400 women, and these patients were allocated to taking coenzyme Q10 or a placebo, which contains no supplementation whatsoever. And what they found was that in patients that were on the CoQ10, it increased the odds ratio of a clinical pregnancy rate by over 240%. And they found that this effect was true in patients that had a normal ovarian reserve, patients that had premature ovarian insufficiency, or in other words, diminished ovarian reserve, and even patients that had polycystic ovarian syndrome. The dose ranged anywhere from 200 milligrams to 1200 milligrams per day. But the key is that in all of these studies, the benefit is shown if you are taking these supplements for at least 8 to 12 weeks. So ideally, anywhere from a 2 to 3 month time frame prior to trying to conceive is when this could potentially show the biggest benefit. In addition, coenzyme Q10 has been shown to be beneficial in males as well. So this is another systematic review of 9 studies where taking 200 milligrams per day of coenzyme Q10, again, somewhere for 3 to 6 months prior to fertility treatment, shows that in men, this can improve sperm motility and concentration, as well as improve something called sperm DNA fragmentation. In addition, it has been shown to increase fertilization rates in patients undergoing in vitro fertilization. As far as the second supplement, it's DHEA, This is a steroid hormone that is secreted by both your adrenals and also your ovaries. And this hormone is essential for the production of follicles. This is another systematic review meta-analysis of 9 different studies. And this in particular is in patients that have diminished ovarian reserve and they're undergoing in vitro fertilization. The dose that is often used is 75 milligrams a day for 12 to 18 weeks, again, at least 3 months prior to treatment. And they found that the patients who were taking DHEA had an increased number of eggs retrieved at the time of in vitro fertilization. They had an increase in clinical pregnancy rates by 27% and live birth rate at 76%. Again, it's important to remember that this is specifically in patients with diminished ovarian reserve. So it's unclear whether these results can be extrapolated to patients with a normal reserve. Then this is just a quick slide showing other potential supplements that have been studied and what their possible mechanisms of action and benefits are. These aren't studied as well as the prior two that I was just mentioning, but these are also some to take into consideration. So we have myo-inositol and acetylcysteine, L-carnitine, and DHA-EPA, which are the omega-3 fatty acids, often found in things like fish oil, krill oil, or algae oil. And you can see what they may potentially improve. Now, let's quickly shift gears to nutrition and its impact on body weight. So aside from nutrition, other lifestyle factors certainly can impact fertility. And the factor that has the most compelling data behind it is body weight. So the clinical impact of obesity, which is defined as a body mass index of greater than 30, is very well characterized in the literature. We know that for every 5 kilogram body weight increase, there is about a 5% increase in the mean duration of time to conception, meaning that the heavier the patient is, the longer time that it will take for her to achieve pregnancy. In addition, we also have large data sets showing the significant impact that obesity can have on pregnancy. For example, a 2007 study of over 7,000 American women that had normal menstrual cycles showed that there was about a 35% lower likelihood of getting pregnant compared to their normal weight counterparts. And another study from 2008 of 3,000 Dutch women, again with normal menstrual cycles, showed that the probability of getting pregnant spontaneously declined with every BMI point over 29, and this was a linear association. The reason why I'm highlighting normal cycles is because one of the main ways that obesity can also impact pregnancy is that it can disrupt regular ovulation and it can cause irregular menstrual cycles. And in those situations, pregnancy will be extremely difficult to occur if a patient is not ovulating on a regular basis. In addition, there are also some other fertility outcomes that are notable in the literature. When compared to lean counterparts, obese patients have an increased risk of spontaneous abortion, which is, in other words, a miscarriage, and even recurrent miscarriages. And once patients do get pregnant, we do see that obese patients have an increased risk of gestational diabetes, preeclampsia, C-section, postpartum infection, increases risk of postpartum hemorrhage, and also DVT, which is a deep venous thrombus, or basically blood clots. So the recommendation is to see if there is any possibility of achieving any kind of weight loss before pregnancy, because this has been shown to be the most effective intervention in improving a lot of these medical issues that can occur in early pregnancy and during late pregnancy. And although it would be ideal to have a normal BMI, it's extremely challenging to do so. But the good news is that anywhere from a 5 to 7% weight loss can significantly improve metabolic health and also reduce these medical comorbidities that we're seeing in pregnancy. So from there, what we're going to do is start transitioning into some evidence-based weight loss strategies. Whenever we think of weight loss, there is a very simple model that is often shown in many different circles, and this is the CICO, or calories in, calories out model. So essentially, what they're saying is that if you can consume fewer calories than your body burns, you're going to lose weight. So in essence, you're having more energy out than in. Contrast that, if you're consuming more calories than you're burning, you're going to be gaining weight. So this essentially is following the first law of thermodynamics, and it's an extremely simple model. But can it really be this simple? Is it purely just strictly based off of calories? Well, on the surface, it looks like a very simple model, and that there are many other factors that should be at play instead of just calories. If we dive a little bit deeper and closer into this model, we can identify that it's actually way more complex than it originally looks on the surface. So first, let's start with the calories consumed portion. We know that there are so many factors that can impact this, starting with appetite. So the amount of calories that you're going to consume is highly dependent on your appetite. And what controls your appetite? We know that there are certain hormones that can regulate it. So depending on how high or low these hormones are, that will influence the amount of food that you will likely consume. The second thing is the actual foods that you consume. We know that there are different types of food qualities that exist, and not everyone has availability to all of these foods. In addition, some of these foods might actually be more challenging for patients to obtain due to socioeconomic status and also the actual energy density of the food. We know that there are different foods that, depending on how big or how small they are, they actually will contain more or less calories. A third factor to consider is how many calories are you actually absorbing from the foods that you're eating. Believe it or not, there are some foods that you can consume that are high in calories, but your body actually doesn't wind up absorbing all of those calories. And this could be dependent on many factors such as your age, the status of your microbiome in your gut, and also the fiber content of the food that you're consuming. Lastly, there's psychology. So we know that stress can significantly impact the amount of food that you're eating. Everyone's heard of stress eating. We also know that your mindset can also play a big role as to how you view yourself when you are consuming foods, your self-esteem, and also the environment. How are the other people around you eating? And that can all influence the number of calories that you are consuming. So that's just from the first side of the puzzle. Then what about the calories out portion? So there are four different components that contribute to this calories burn model. And the first one is your basal metabolic rate. This is essentially the energy that you're burning at rest. So if you think about it, your body has to use energy and use calories just to keep you alive. The second component is your exercise activity. The amount of energy that your body needs to do any kind of exercise activity is certainly going to burn calories. And this is the more obvious one that we always think about. A third one is something that's not well known by many people. It's something called NEAT, or non-exercise activity thermogenesis. And this was actually really interesting because your body's actually burning a lot of calories in activities that you're doing that aren't actually formal exercise. So any kind of like walking or fidgeting or any kind of day-to-day movement is actually burning calories. And then the fourth and final component is the thermic effect of food. And this is actually the amount of energy that your body is using to break down the foods that you're eating. And as a result, that means that different foods that you consume are going to be absorbed at different rates, depending on how much energy your body needs just to extract the calories from the foods that you are consuming. So we're going to actually dive into each one of these in a little bit more detail, just so that we can go over different kinds of strategies that you can implement into your current routine. So let's quickly just go back to the basics. A calorie is a measurement of energy, and it's defined as the amount of energy required to increase the temperature of 1 gram of water by 1 degree Celsius. It's a very scientific explanation that you don't really need to know. But what you do need to know is that there are three major macronutrients that comprise the caloric content of any given food. And these are the three major macronutrients and one bonus macronutrient that people don't actually really think about. So for every gram of carbohydrate that you consume, that is equivalent to 4 calories. Protein also is equivalent to 4 calories. Fat is actually the highest with more than double. 1 gram of fat is equivalent to 9 calories. And the one that many people don't really consider is alcohol. Every gram of alcohol is equivalent to 7 calories. So this is one thing that many patients fail to acknowledge, is that alcohol does play a significant role in caloric intake, despite providing no nutritive value. Now, I want to go over this landmark study that was published in 1992 that showed that there is a huge discrepancy between self-reported and actual caloric intake in individuals. In other words, we're very poor at determining or trying to estimate the number of calories that we're actually consuming. So this was a study that took 200 obese participants who were having difficulty losing weight. And these participants were reporting that they were eating fewer than 1,200 calories per day. And what they did in the study was they actually went ahead and calculated everything. They calculated these individuals' basal metabolic rate, their thermic effect of food, how many calories they were burning via exercise, and most importantly, the number of calories that they were consuming. And what they found was that these participants were underreporting their food intake by 47%, and they were underreporting their physical activity by over 50%. So the difference between the actual number of calories consumed versus what they thought was consumed was over 1,000 calories per day. which clearly we don't have a good understanding of the food that we're eating. You can just take as an example oil. If you put 1 tablespoon of oil on your salad versus 3 tablespoons of oil, you probably will hardly ever notice a difference. But the difference between 1 and 3 tablespoons is over 300 calories. So it's definitely something to take into consideration. Now, what about the factors that are controlling the energy out portion of the equation? So as we recall, there's 4 different factors. So the basal metabolic rate, exercise activity, NEAT or non-exercise activity, and the thermic effect of food. So the BMR, the basal metabolic rate, accounts for the vast majority of the energy that you need per day. Again, this is just the cost of keeping you alive. If you think about an iPhone, for example, if you just left your iPhone there on the table without touching it for 24 hours, the battery will be drained a significant portion. And that's the same thing that's happening with us. If you just sat there and did absolutely nothing, your body will still be burning about 50 to 70% of all of the calories that you are consuming per day. And this can be impacted by your age. Your metabolism tends to slow as you get older. Your body size, the larger you are, the more calories your body's actually burning. And lean mass, we know that muscle mass tissue actually burns more calories than fat mass. And the study showed that the mean value for a resting metabolic rate for women is approximately 1,500 calories per day. The next thing is the thermic effect of food. So again, this is the amount of energy that your body has to put in to extract calories out of food. So this accounts for about 5 to 10% of your total daily energy expenditure. And you can actually use this to your advantage because we know that different foods have different thermic effects of food. So fat has the lowest TEF. It's about 0 to 3 calories per 100 calories of fat. And protein is the most expensive. It actually has a thermic effect of food of about 20 to 30%. So in other words, if you consume 100 calories of protein, you're only really getting about 70 to 80 because your body had to burn that much just to get that energy out of the protein. Is one key benefit that you can use to your advantage to actually extract fewer calories from the food that you're consuming. And then in addition, then there's the exercise and non-exercise activity thermogenesis, which accounts for the last 30% of your total daily energy expenditure. As you obviously already know, this is extremely modifiable. Studies have shown that people who are resistant to obesity tend to fidget a lot, and obese individuals tend to have a very low NEAT. So this is something you can actually consciously make a change about. So this could involve taking the stairs or trying to park a little bit further from where your destination is. Any kind of additional movement you can do per day. Whenever you're sitting, just trying to fidget, drinking a lot of water throughout the day so that you can go urinate a couple times while you're at work. All of these things will add up. So now that we have that out of the way, now that we have the picture of calories in, calories out, and understand that it is a very complex system, now let's actually talk about the tactics and strategies that you can use on a day-to-day basis to try to achieve fat loss. So again, this is our framework that we're working with, and we're going to talk about how you can potentially try to address some of these major factors. So let's begin with the calories inside. So appetites. By and large, the overwhelming evidence shows that sleep deprivation has the biggest negative impact on your appetite. Studies show that if you are routinely sleeping fewer than 7 hours per day, this is one of the worst things that you can do for your health. We know that sleep deprivation is associated with increased cortisol. And what cortisol does when it's constantly elevated, it can lead to increased fat accumulation. It can increase the risk of type 2 diabetes, high blood pressure, which is hypertension, and cardiovascular disease. In addition, sleep deprivation has been shown to have a huge impact in leptin and ghrelin. These are your hunger and your satiety hormones. So these are the hormones here that are playing a major role in your appetite. As such, as you can imagine, you're getting more ghrelin, which is the hormone responsible for increasing your appetite. And as a result, you're getting an increased energy intake, so you're consuming more calories. And sleep deprivation also reduces your basal metabolic rate. So your body's actually burning fewer calories at rest. So this is one of the first things that I like to mention to patients, because if you don't get your sleep in order, you're kind of already starting at a deficit. Obviously, this is a lot easier said than done, but if there are any ways that you can try to improve your sleep quality, it's going to be first and foremost to try to get under control. Now, aside from sleep deprivation, your food choices also play a big role in your appetite regulation. And that leads us to the second part of this calories in portion, which is the foods consumed. So What is the best diet for weight loss? The good news is that research shows that every single diet pretty much works. And the reason for that is because they all follow a pretty similar mechanism. They all ask you to restrict something, whether that be counting calories, whether that be counting points, which is popular in Weight Watchers, whether that's low carb or low fat, or if it's trying to consume clean foods or healthy foods by reducing processed foods, or it could be completely eliminating specific nutrients. So if you're following a plant-based diet and you're not consuming animal proteins, or a ketogenic diet where you are consuming very, very low carbohydrates, or another one that's popular these days is time restriction, where you are shortening the window at which you can consume foods, say about anywhere from 8 hours or 12 hours. All of these things are basically restricting your energy intake to an extent. And as such, you are consuming fewer calories. But the good news is, as I was alluding to earlier, is that research shows that they are all equivalent. This was a large study here, systematic review, meta-analysis of low fat versus low carb. And their conclusion was that both diets are effective for weight control. This was another large study looking at intermittent fasting, which is that time restriction, condensing the number of hours that you can consume foods versus continuous caloric restriction. Again, it showed that there was no real clinically significant difference between just reducing your calories or just doing time restriction in terms of your food intake. And then lastly, this was another very large meta-analysis, about 48 different trials, 7,000 participants, looking at all of these popular named diets. And they found that overall, the weight loss differences between these individual named diets were very small, which in conclusion, this supports the practice of recommending any diet that a patient will adhere to in order to lose weight, because adherence is the most important factor. So what did we take away from that part is that we have to just look at what all these diets have in common. And the vast, vast majority of them are recommending just improving the quality of the foods that you're eating and not focusing so much on the quantity, because when you choose to improve the nutrient intake of the foods that you're consuming, you naturally will be reducing the quantity of food that you're consuming, because these foods tend to have less calories, they tend to be more satiating, and as such, your stomach can only hold so much food. So the more of these nutritious foods that you're consuming and trying to focus on not consuming the ultra processed foods, these bad foods per se are going to naturally start falling out of your diet. So the way that I always like to tell patients is to try to see how many things can you add into your diet. Look at the Mediterranean diet and see how many of these healthy foods can you continuously add into your current routine. And the more foods that you eat of these, again, the more satisfied you're going to feel and the fewer calories you're going to consume naturally. In addition, restrict something. This is going to either be by limiting the choices of foods that you're going to eat or the eating window. All of these things can work. The key is that what works for one person might not work for another. So you have to experiment and pick the intervention that feels the least restrictive to you. Low carb might be easy for you, but it might not be easy for your partner. The same could be true for intermittent fasting. It might be easy for you to consume calories in just only an 8-hour window, whereas your partner might prefer to do something more like a plant-based diet. Every person is going to be unique. And the key is that it's something that doesn't feel restrictive for you so that you can ultimately adhere to it over the long term. Now, let's take a quick detour and talk about the calories absorbed portion. So we don't absorb all the calories from the foods that we consume. And these absorption rates will vary across different food types. So we know that foods that are very high in fiber, which by definition, fiber is unmetabolizable energy, increases satiety. And satiety is just another fancy way of saying increases your feeling of fullness. Studies show that fiber can reduce your body weight when you substitute it calorie for calorie with non-fiber carbohydrates. And this makes sense because it contains the same number of calories, but your body isn't actually able to absorb it, but yet you're still getting that benefit of feeling full from the food. And studies show that trying to consume at least 34 grams of fiber per day is going to be beneficial. So it might be helpful to just jot down all the foods that you're consuming on a regular basis for a few days and just get an idea of how much fiber you're actually consuming on any given day. Then there's also high protein content. As we already said before, we know that we're going to lose about 20 to 30% of the calories from something that's protein rich just digesting it. This is that thermic effect of food. In addition, high protein diets have been shown to have a greater satiating effect compared to an isocaloric diet that has lower protein. Again, you're consuming the same number of calories, but when you look at the studies, the people who are consuming higher protein have a much higher satiety level than patients that are consuming lower protein. And in addition, they have a greater likelihood of losing weight and retaining their fat-free mass, in other words, their muscle mass. And remember what we were alluding to earlier, that muscle mass actually also helps improve your basal metabolic rate. So this study showed that consuming upwards of 130 grams of protein per day was more beneficial than consuming 75 grams per day. Again, do you know how many grams of protein you're consuming? If you don't know, it's very likely that you're not consuming anywhere near this much. So it might be helpful, again, to just write down everything that you're consuming in a day. And there's a lot of apps, free apps that you can use to help track this, to get an idea of how much fiber and how much protein you're consuming. Then lastly, there is the water content of food. So there is this concept of food density or energy density. And we know that consuming low energy density foods can help you feel full longer. So what are low energy density foods? These are foods that occupy a large volume of space, but they're full of water and as such have fewer calories. And this is just a simple image that I saw online that you can compare. These are all 200 calories of different foods. So you can see how much more broccoli we need to consume just to get the same amount of calories as just this handful of gummy bears. Same thing with celery versus just a small drink of soda, an apple versus a little bit of peanut butter. As you can see, these foods are all high in volume, high in water, and as such, they will occupy a lot more space in your stomach. So it can feel like you're eating more food and reducing your hunger despite consuming much fewer calories. And this has been shown time and time again in the literature, and these are some of the studies that we see that. So it can help reduce feelings of hunger and deprivation while helping you also reduce your weight. Lastly, let's talk quickly a little bit about the psychology. We see in studies that the biggest challenge isn't losing the weight, it's actually maintaining the weight loss. So unfortunately, we see that 80% of people will regain all the weight that they lost in just 1 year. That jumps up to 85% after 2 years and 95% after 3 years. And we see that in a lot of these individuals, they tend to gain more weight than what they started with. However, the studies do show that if you are able to maintain the amount of weight that you lost for 2 years, you are much more likely to actually continue that maintenance for the next 5 to 10 years. So how is it that we're able to maintain our weight loss? And there is one large study that showed that individuals who are able to maintain their weight loss do better when they have a structured plan. So when there's some specific program that you're following and you have someone that can help you stay accountable for that, you are more likely to maintain that weight loss. In addition, individuals who were successful at weight loss maintenance noted that they had to basically reprogram their habits and behaviors. Because remember, this isn't a quick fix, and this isn't something that you're trying to do for 6 months or even a year. This is something that you're trying to maintain for the rest of your life. So that's going to actually require you to change the person that you are. So a lot of these patients were also saying that they're having an identity shift, telling yourself, what kind of person do you want to become? And this has actually been demonstrated in a very popular book, Atomic Habits by James Clear, who has delved into all the research of what does it take to build habits that will actually lead to lasting changes. And quote, he says, the key to building lasting habits is focusing on creating a new identity first. You need to start believing new things about yourself. So you need to tell yourself things like, am I the type of person that chooses to eat healthy foods? Am I the type of person who doesn't smoke? Am I the type of person who exercises on a regular basis? So you have to decide that you're this kind of person that's going to participate in healthy behaviors and kind of reprogram your habits and behaviors to allow yourself to do these things. And without that shift in your psychology and your mindset, it's going to become a lot more challenging to actually continue pursuing what your ultimate goals are. Now, just a quick word on physical activity. This is the calories out portion of the equation. The reason why physical activity can be so beneficial, aside from the exercise activity thermogenesis, which is burning calories, we know that if you're able to build muscle tissue, it can serve as a metabolic sink, meaning that muscle tissue is more metabolically active than fat tissue. So in other words, if you remember the resting metabolic rates, the number of calories that your body's burning just at rest, the more muscle tissue you have, the more calories your body's going to burn, just maintaining that expensive muscle tissue. So that is one of the other key benefits that exercise can help from the calories out portion. And the nice thing is that you don't have to do a high dose of exercise. The biggest benefits in the literature that we see are in individuals who go from doing zero exercise to just about 2 to 3 hours per week, which isn't that large of a time commitment if you really think about it. This is essentially just 20 minutes per day, if possible. And it doesn't have to be anything extensive. We know that it can be as simple as just brisk walking, which can improve the muscle tone in your legs and your calves. It can improve your cardiovascular fitness a bit. And the simple recommendation provided by the American Heart Association of trying to get at least 150 minutes a week of moderately intense activity can be extremely beneficial. And you can also include other muscle strengthening exercises on 2 or more days of the week. And that would be for the upper body, as a lot of the cardiovascular exercises tend to be more lower body focused. So now let's kind of just wrap this all up and go over a key takeaways portion. So the best evidence-based weight loss interventions include getting high quality sleep. This is significantly important because sleep deprivation is associated with an increase in your appetite, a decrease in your metabolism, and an increase in your hunger hormones, so that you are essentially forced to consume more calories. In addition, it's important to focus on the quality of the foods that you're eating rather than the quantity. That's what a lot of these diets have in common, is that you are trying to consume more fruits, more vegetables, more lean proteins, more healthy fats, etc. And when you're improving the quality, inadvertently, you're going to be eating more protein, and protein has a high thermic effect of food, so you're going to be burning more calories just consuming protein, and also you're going to be getting more satiety or staying more full. In addition, when you consume more fruits and vegetables, you're also going to be eating more fiber, which again is a high satiety food and has low caloric absorption because you are unable to metabolize that fiber. In addition, you can eat more low energy density foods. These are these foods that have high water content and they're more voluminous. Again, fruits and vegetables are probably going to be the biggest factor here in helping you maintain fullness despite consuming fewer calories. You can experiment with different dietary protocols. Again, data shows that they all work. You have to choose the one that seems least restrictive to you and the one that's still allowing you to get a good number of calories from all these foods listed above. Then other things that you can consider are increasing your NEAT, non-exercise activity thermogenesis. So trying to take the stairs as much as possible, trying to stand whenever you can, fidgeting, parking farther away, etc. And then lastly, don't ever forget about the psychology and the mindsets. This has to be sustainable for you. And as a result, you have to try to create habits around your current day-to-day life that will allow you to sustain these changes to create a new identity and ultimately create a new lasting behavior for fat loss. Overall, my best recommendation is to try to follow a Mediterranean diet as much as possible. The US News and World Report always publishes the best diets every single year. And not surprisingly, the Mediterranean diet is usually always number one, not just for their potential benefits in fertility, but also in reducing risk of all of the leading killers in the United States, cardiovascular disease, diabetes, etc. And these are different kinds of foods that you can focus on trying to add into your current diet. And again, it doesn't have to be sweeping changes. The more of these healthy foods you can add in, the more quality foods you're consuming, the more protein you're going to be consuming, the more fiber, the more water, and the more full you're going to potentially be feeling as well. Lastly, so if you are in the process of trying to lose weight, a goal of 1 to 1.5 pounds per week is plenty. This means that you should reduce your caloric intake by anywhere from 500 to 750 calories per day if you are interested in counting calories. So an eating pattern that contains anywhere from 1,200 to 1,500 calories per day can help most women lose weight safely. And again, don't ever forget to pick a form of restriction that is least restricted to you, because sustainability is definitely the most important factor here. As far as physical activity, it can be as simple as brisk walking. Try to do about 150 minutes of exercise per week of moderately intense activity and muscle strengthening exercises. But even if you cannot adhere to these numbers, something is always better than nothing. So any kind of activity that you can do could also potentially be beneficial in your weight loss efforts. Thank you very much, and I hope you found this informative. And if you have any other questions or concerns, you can always give us a call at Columbia University Fertility Center and seek a consultation. Thank you.